Welcome to Jane's OET Hub. Today we will discuss about updated OET writing assessment criteria. This is the checklist the OET examiner used to score your writing. If you know what the examiners are looking for, then it will be easy for you to frame the letter in order to get a high score in the subtest. There are 6 assessment criteria. They are purpose, content, conciseness and clarity, genre and style, organization and layout, and language. Now we will see how they are scored. Purpose 3 marks, content 7 marks, conciseness and clarity 7 marks, genre and style 7, and organization and layout 7, language also 7 marks. So total it will be scored out of 38. Now we will see one by one. The first one is purpose. It is divided into 2 parts. First part is it should be immediately apparent to the reader. That means the reason for writing this letter should be immediately clear to the recipient. So it is better to keep this part of purpose in the introductory paragraph itself. I will tell you a sample introductory statement. I am writing to refer Mr. Benjamin, who was diagnosed with type 2 diabetes mellitus, as he requires continuous monitoring of his diabetes. So from this, the reader will understand the medical issue of the patient and what he needs to do for the patient. Now we will see the second part of purpose. According to this, it should be sufficiently expanded. That means you need to explain further details of the purpose throughout the following paragraphs. We'll move on to the second criterion, that is content. In this, the assessor will see whether you add all relevant information which is appropriate to the reader. So always keep the reader in front of your mind. For example, if you are writing a letter to a doctor, the social history may be irrelevant. Please make sure you add the key information which is needed to continue the care for the patient. You can get this information from the discharge plan or management plan of your case note. This information will be written in the request part of your letter. Always remember not to add your own judgment or assessment. Please do not misinterpret the symbols and acronyms used in the case notes. Now we will move on to the third criterion, which is conciseness and clarity. In this criterion, the examiner will see whether you omitted all irrelevant information. The suggested length of the letter is 180 to 200 words. But they are not very strict about this word limit. If you add all relevant information and omit all irrelevant information, still the words are less than 180 or exceeds 200, but it may not be a problem. So overall, your letter should be as much clear as possible to the reader. Next we will discuss about genre and style. It represents the way that we use the language. There is difference between the usage of language when you write the letter to a healthcare professional and a non-medical personnel. So use your language appropriately according to the reader's discipline and knowledge. The layman may not be knowing the complex medical jargons. We must be careful when we use abbreviations in the letter. always use the abbreviations which is appropriate to the reader. If you think that the abbreviation which is used in the case note is not common or not universally accepted, then it is better to write it in full form. The next one is organization and layout. We must write the letter formally. There should be clear distinction between the paragraphs. Always prioritize your letter according to the reader. It should be laid out very logical, clear and concise manner. Please remember there is no specific template for OET letter because the cases, patients and reader will be always different. So I will discuss in detail how to organize your letter in next video. Now we will move on to our final criterion, which is language. In this, we have to see the vocabulary, what you used should be appropriate to the reader. Then the grammar should be accurate. Focus on correct spelling and proper use of punctuation. Here completes all the 6 criteria which is used for writing assessment. I hope you all understood the revised writing assessment criteria. Please keep all these points when you write the letter. If you find this video useful, please like and share it. For further videos on updated OET tips, please subscribe my channel.